cavity is a bacterial process that occurs on a tooth. What happens is the bacteria eat the sugar, whether it's from a soda, a cookie, any other form of a simple carbohydrate in your diet. And as a byproduct of the digestion of that material inside of the bacteria, it will secrete an acid onto your tooth. When acid is exposed to your tooth for a long enough period of time, it will start to dissolve that tooth structure away. When enough tooth structure is dissolved, it will form a soft spot on your tooth, and that is what we call a cavity. The cavity can progress, depending on the surface, at a relatively quick pace, especially if multiple times a day there is a sugary or acidic environment in the mouth. It is our goal with routine maintenance to not have any cavities, but in the event that there is a cavity, we have a very conservative method to treat it. How we treat small cavities is a process called a filling. For a filling, what we do is we remove the tooth structure that is damaged and decayed. We get it very clean, and we place a tooth-colored restoration. We do not place silver or amalgam fillings in our office because they tend to require removing much more tooth structure than is necessary. A benefit of a tooth-colored filling is that it will be a much more conservative preparation on your tooth, meaning much less tooth structure is needed to be removed than with the outdated version of a silver filling. Another advantage to using a tooth-colored filling, other than it being conservative, it is a bonded restoration, meaning that it will have a chemical interaction with your tooth structure. The previously outdated technology of a silver filling actually is not bonded into your tooth at all. How a silver filling seals in the mouth is by corrosion. How a silver filling unseals in the mouth is also by corrosion. One disadvantage also to a silver filling is that it expands over time. With this expansion, it can cause a lot of stress fractures inside of the tooth and ultimately lead to fractures of the tooth structure, which will lead to more expensive and costly tooth treatment. Also, in severe cases, it can cause the tooth to need to be extracted because it will break too far below the bone.